Everyone needs healthy sleep. Have you ever considered that we spend approximately 1/3 of our lives sleeping? A good night's sleep is an absolute necessity. Just like proper nutrition and exercise, healthy sleep is essential for your health and well-being. Obstructive sleep apnea, or OSA, is a very common condition where your upper airway undergoes certain changes. It may narrow, limiting airflow as you breathe. It may vibrate, commonly heard as snoring, or it may collapse, causing you to stop breathing. This is called an apnea. Your airway may even move through all 3 stages. You may experience one or more of a range of symptoms: snoring, excessive daytime sleepiness, irritability, morning headaches, impaired memory, depression, reduced sex drive, and restless sleep. By far the most common and easily identified symptom is snoring.
I snored quite a bit and experienced sleep disturbances around every minute and a half. That sleeping ritual not only kept me awake, but my wife as well. And now I would recommend anyone who snores to get a sleep test.
If you have sleep apnea, not only do you snore, you periodically and repetitively stop breathing during your sleep, sometimes for as long as a minute. The effects on your body build up night after night, year after year. Recent research shows that snoring and sleep apnea are associated with many serious conditions. Left untreated, they are a contributing risk factor in high blood pressure, heart attack, stroke, diabetes, and depression. More than 35% of all people with sleep apnea suffer from high blood pressure, increasing their risk of heart disease. Significantly, 83% of people who continue to suffer from high blood pressure despite taking 3 or more drugs also have sleep apnea. Almost 70% of people who've had a stroke have sleep apnea. Sleep apnea is also associated with a high frequency of type 2 diabetes and impaired glucose tolerance. Sleep apnea affects not just your sleep, but your waking life too.
I was always tired. The kind of tiredness you don't have any control over. And I had to take breaks to get a nap just to continue on through the day. I was really struggling to do my job.
If you don't get enough sleep through the night, you could fall asleep anytime, anywhere during the day, putting you at risk of a serious accident. In fact, people with sleep apnea are 7 times more likely to have a car accident. Here's the good news. There is effective treatment for sleep apnea. Positive airway pressure therapy helps hundreds of thousands of people all over the world get healthier sleep, minimizing their risk of developing associated diseases.
I had a heart attack at the age of 56. Since being treated, my life has really changed. And the doctor says it's a relief to my heart. It sure is crazy what little sleep can do.
Treating your condition should help you feel more energetic, leading to a more active lifestyle, which is essential for fitness and weight loss, all part of the cycle of a healthy life. The benefits of healthy sleep extend to your working life as well.
I became concerned when I felt my productivity decreasing. It was more difficult to stay focused and concentrate on the main issues. Since being treated, my productivity has improved, my stress levels are better controlled, I feel better, and I am clearly more effective.
The first step is assessing your sleep. Typically, an overnight sleep study at a sleep clinic helps your physician or sleep specialist diagnose whether you have sleep apnea. You may also be able to do a simple screening test in the comfort of your own home. Modern technology and clinical expertise make it easy to detect and treat sleep apnea. For more information on treatment options, speak with your sleep health professional or visit ResMed.com. Remember, a healthy life does depend on healthy sleep. For most people who are diagnosed with sleep apnea, the confirmation actually comes as a relief, because sleep apnea is a condition that can be effectively managed with a little commitment. Sleep apnea is not a one-night condition. Treatment is a life journey that can take you a long way on the road to good health. Positive airway pressure therapy is the most effective and widely accepted treatment for sleep apnea. A small device delivers air via a mask to keep your upper airway open. It does not involve drugs or surgery, and the results speak for themselves.
After just one night on treatment, I had so much energy. And it's just putting a mask over your face. So you're not taking any drugs. That's great. And my blood pressure's reduced.
The basic form of this treatment is continuous positive airway pressure therapy, often referred to as CPAP. Fixed CPAP therapy uses one constant pressure all through the night. This is based on the highest pressure needed to keep your upper airway open through certain stages of your sleep. An alternative to fixed CPAP therapy is automatic positive airway pressure therapy, also called APAP, which automatically varies the pressure all the way through the night and from night to night. It actively responds to the continuous changes in your upper airway.
I just fall asleep now and let the machine take care of everything. I'm waking up much more refreshed. I'm sure my life expectancy has been enhanced.
As you sleep, intelligent APAP devices monitor and respond to the changes in your upper airway, from narrowing to snoring to apnea. They sense whether you need a lower or higher pressure, so they provide just the pressure you need when you need it.
I tried it for 2 weeks and it changed my life. The reduction in pressures made it a lot easier for me to tolerate the equipment.
In some cases, if you have trouble breathing out against the fixed constant pressure of CPAP, your sleep specialist may recommend bi-level positive airway pressure therapy. This delivers air at one set pressure when you breathe in and at a lower pressure when you breathe out. Whatever form of positive airway pressure therapy works best for you, it will involve wearing a mask. There are many types of masks available: regular nasal masks with active cell technology, full face masks, and nasal pillow systems. Your sleep professional can help select the right mask for you. An effective, comfortable, and well-fitting mask can make all the difference to the success of your therapy, helping you stay on track. Air leaks around the mask and into your eyes indicate a poorly fitting mask, which will compromise your therapy. Give honest feedback during the initial fitting, especially if you experience air leaks. This will assist your sleep professional to make the necessary adjustments and recommend the right mask for you. A well-fitting mask provides you with a good seal and security, minimizes air leaks, and lets you choose a more comfortable sleeping position.
Unlike the other masks I've used before, the Mirage Activa is fitted quite loosely and allows the cushion's membrane to expand. It's also especially effective in compensating for my body movements and eliminates any leaks, especially when I'm sleeping on my side.
Some people on positive airway pressure therapy experience side effects such as watery eyes, dryness, or congestion in their nose, and dryness or irritation in their throat. Adding heated humidification to your therapy will warm and moisten the air, preventing and relieving these potential side effects. This will enhance comfort and make therapy more effective.
I seem to have a lot of dry mucus in my throat, and since I've had the humidifier, that's gone.
Integrated systems are now available. They come complete with a modular heated humidifier. You can attach this when you need it.
Because I travel a lot, I wanted a machine with the humidifier attached. That way my device is very good, small enough, and light to carry.
There is a whole range of options for your sleep apnea equipment. The right choice will go a long way in your treatment journey and is one of the best investments you can make, an investment in your own health.
I'm beginning to realize how much sleep debt I've racked up for the past 12 years. I mean, it's affected my capacity for learning and doing things. I feel like I've lost a lot of time. I mean, the answer's so simple, and nothing's hard anymore. I just wish I'd known earlier on.
Persistence is the key to gaining the real benefits of treatment. Persistence is vital if you also suffer from any serious health conditions like high blood pressure, diabetes, or heart problems. Losing weight, reducing alcohol consumption, and other healthy lifestyle choices can also help you feel better. If there are times when you can't use your therapy every day, don't let those temporary setbacks become permanent ones. Stay on track for healthier sleep and a healthier life. Discover treatment support and valuable information at our online center, myresmed.com. You are not alone on the journey to healthier sleep and a healthier life. Across the world, there are sleep apnea support groups that can help you and your family. Involve your family and friends. They can be a source of strength and encouragement once they understand your condition. When you begin to enjoy the benefits of therapy, others will notice the difference.
We started to get our dad back. After using the mask in the machine, he was able to mow the lawn, clean out the fridge, take out the garbage. In fact, he would tire himself out with all the new things that he could do.
For the partner, it can be like a new lease on life.
Mike is rested, he's energized, and he's relieved. We travel with the machine always. It's now a staple in the quality of our life.
Like other diseases and conditions, sleep apnea can run in your family.
I do recommend treatment. My son, who has the same symptoms, is using the AutoSet Spirit as well.
Remember, sleep apnea doesn't just affect your sleep. It affects many aspects of your health, your life, and the lives of those around you. Managing your condition deserves a comprehensive solution, a holistic approach that goes beyond making sure you have the right equipment. At ResMed, we offer complete solutions with world-class products and the most comprehensive range of tools and techniques to help you and your sleep health professional optimize your treatment. In addition to a range of treatment choices, we work actively to make people aware of sleep apnea and its consequences. We are waking people up to sleep. If you enjoy browsing the internet for information, discover valuable treatment support at myresmed.com, our online center.
I like the way the site myresmed.com is organized.
Your website is informative and it shows that you care for the user.
I appreciate the answers to my questions on sleep apnea.
Another useful site is healthysleep.com, where you can learn more about snoring and sleep apnea, the risks and the diagnosis. Or visit our company website, resmed.com, for a good overview of sleep apnea and your options. As part of our holistic approach to a complete solution, we also provide treatment and educational support. The long-term benefits will help you and your sleep health professional to manage your condition more effectively.